in the 90s, our research department became more sophisticated, and our outcomes actually improved to a little over 80%. So 80% of the young people a year after they left our programs were home living with their families, working or going to school successfully, and not in trouble with the law or back in state custody. But in the late 90s, the head of our research department came and met with me and said, Pat, we've got a problem. And I said, what do you mean? And they go, well, there's one group of our young people that are not doing very well when they leave our programs. I was a little surprised by that, and I go, well, I thought the kids were doing really well. And they go, well, most of the kids are doing well, but we're having particular problems with the older kids that leave our program. I said, what do you mean? And they said, well, the kids that are 17 and 18 are going home are not having juvenile justice problems, they're having criminal justice problems. You know, they're going to jail. They're having serious adult problems. They're living in mental health hospitals. They're living on the streets homeless. They're having tremendous problems at a much higher rate than the younger people. Well, I said immediately, this must be wrong. You know, our belief was the longer a young person could stay on a residential program, the more successful they would be as a young adult. Well, I was terribly wrong, and the information was very accurate. So we basically started doing some research to find out who was providing good services for young people aging out of foster care, you know, from 18 to 21, 22 years old. We really only found a couple small residential programs across the country that really had more like a group home, kind of extension of foster care. And so we really asked ourselves, we said, you know, what can we do that's consistent with our belief that young people should be living safely in the community rather than putting them back in a group home till they're 20 or 21 years old. And we hired a consultant, a guy named Rusty Clark, a researcher out of Florida. If you've ever known any research, this is one of the wildest, funniest guys you've ever worked with. But had some different ideas about working with young people in the community. And but one of the biggest problems we had at the time, even though we engaged Rusty to help us a little bit, we really couldn't find any funding. The state says, look, these kids are 18, we've taken care of them for this many years, there's no funding available. And fortunately, we were able to find a man, and I'll show you a picture here, named Clarence Day, who was able to really help us begin funding the research. But just a little bit about youth villages over that period of time. We grew dramatically in providing other services as well. And I'm going to talk just a little bit about youth villages today and then come back to the program for aging out, so you know that we are going to talk mostly about that. But we provide services in 12 states and District of Columbia. We provide care for young people primarily in the foster care, juvenile justice, and mental health systems or in danger of going into those systems. We provide mostly intensive in-home services. We care for about 23,000 young people a year, but most of the young people we care for is preventing them from ever coming into care or when they return home or help them return home safely back to their family. We also provide the LifeSet program we're going to talk more about. We also provide residential treatment in several states we provide services in, but usually it's the high-end kids, and also therapeutic foster care in Tennessee and Mississippi. Like you said, we have about 2,700 staff. But this is the guy that we went to and for some help, for some funding in 1999, because the state wouldn't give us any money. This man's name is Clarence Day, and he said, well, I'll give you some seed money for 3 years. Like a lot of funders do, they say, we'll give you some seed money for 3 years, and we expect the state to take over the funding of the program. So for the first 3 years, we developed the program, built a model, and unfortunately, we went back to the state and asked for some money, and they said, you know, we don't have any money. And so we went back to Mr. Day, and fortunately, Mr. Day has continued to support our work. But now I'm going to turn the program over to the head of our state program, Charmaine Cromer, who's going to talk a little bit about the program specifically and what we do to help young people aging out of the foster care system.
Hello. I wasn't originally on the list of speakers, so I'll introduce myself. Charmaine Cromer. I've been at Youth Villages around 19 years now, and I oversee our Tennessee YV LifeSet program along with intensive in-home services, foster care, residential services, group homes, mentoring, and our special ICE crisis program that's across the state. A little bit about YV LifeSet, just so you know what we're talking about. When we say YV LifeSet, we used to call this program Transitional Living Services. It was a very general term. It could mean a whole lot of different things. So we did a lot of research and also research with our young folks, and we all agreed upon YV LifeSet because it tells a little bit about what we're trying to do with the aging out youth. The program itself, basically, our mission is to work one-on-one with the youth. Each youth has their own specialists, and the specialists carry cases, about 8 to 10 youth, and they're on call to them 24/7. The focus is related to mostly housing, education, employment, just basic independent living skills, interviewing skills, being able to figure out if you're having financial issues, who do you go to, how do you get an apartment, parenting. We have, a lot of youth who also are parents and also trying to learn to live independently themselves. So we focus a lot on that, on skill building, and then just their physical and mental well-being, being able to take care of themselves, take care of their mental health, any mental health issues that they would have, along with all the other things that when a lot of us were growing up, we had a tremendous amount of support to do. And I always tell folks, I had a young lady that I was doing a presentation with one day, and I said, before we get up there, say something about what's one of the most important things that your YV LifeSet specialists did. And I was thinking she would say something like, found me housing, when I was homeless. Or I didn't have a job. She helped me get a job and helped me learn how to budget, because that's definitely on every kid, as you can imagine, around this age group, 17 to 22. It's hard to know how to manage your finances, and you're also having to pay for everything that you're not used to. So she said, she goes, the most important thing that my YV LifeSet specialist did was when I moved into college, the first day of college, you look around and you see all of these other kids and their parents and aunt and uncles and nieces and nephews moving into the college. She said the most important thing that my counselor did for me was she went with me that day. She was my family. She helped me move in. She helped me get my comforter and all my stuff, the little fridge set up in my room. And so I just wanted to say that because it really hit me about, it's just not about basic needs that we're helping here with. A lot of times you'll ask the young adults, like, what's important to you, and it's having that connection. So the being on call is a big thing. We have kids that call us for very serious reasons. You're feeling hopeless about something, things aren't going right, you had a fight with your family, to actual, I broke up with my girlfriend, what did I do? And so there's a whole range of things that the specialists are supporting and working on. That's why that their caseloads are on average around 8 to 10. And they visit them once a week at minimum. We do have some kids that we have to see more, but it's always once a week, and usually it's targeted on something that the youth finds very important and basic needs that we need to get taken care of. We have kids that are in college, so we definitely have a lot of things to work out around that, and transportation. We also have a program focuses on helping them set their own goals. What do they want to do in the future? Who do they want to be? Sometimes they're not sure. And just like, a parent would or a mentor would, that's what we're helping them get to. Our program model, and I know I should be clicking here, is based, and I'll come back to that, is based on a very tight supervision process, and I think that's what makes this type of program a little bit different than just, setting somebody up with a mentor, or setting somebody up with just a community transitional living program, is that our specialists get lots and lots of training and lots of supervision. So each week you're getting a supervision with a clinical supervisor, and then at another time during the week you're also getting supervision with a licensed clinician, and it's focused on making sure that all the different things, the mental health, the physical health, the independent living, that we're working on all that at the same time. If I go back to the previous slide, it just tells you a little bit about how many youth that we've served, over 8,500 since 1999. Right now, we're serving around 950 youth. Most of those are in Tennessee. Like today, I have about 700 kids that we're providing this service to. We have expanded in other states due to need and interest in helping this population. As you can see, there's about 6 other states there besides Tennessee that we're now involved in. In regards to our outcome and evaluation data, we have internal data collection that we do. We have a team of researchers that work and follow up on these kids. We do youth satisfaction surveys. Those are administered every 2 months. That's to make sure that the kids that are in the program are satisfied with services. We also have our research department. They follow up with youth after discharge at 6, 12, and 24 months. And you can see the areas, this is the areas that they're focused on and follow up. So we get data back at the 6, 12, and 24 months on how that they're doing. This shows where our kids are when we follow up at 6, 12, and 24, whether they're still living independently after discharge. So it's around 88%, 84% at 24 months. We also follow up on specific areas, and here's a couple examples of those. At those that are currently in school, graduated, or employed, you can see it's 83% at 6 months, and then 84% at 24 months, which is, to me, is really good if you know where a lot of these kids started out at. Youth reporting no trouble with law at 24 months is 76%. That's one of the measures that we collect on. In collaboration with Tennessee and also wanting to do something more outside of just our follow-up at 6, 12, and 24 months, we realized that there wasn't a lot of evidence or very many studies that have been done on this population, and we knew that we were doing good work and we knew that we were getting good outcomes, but we really wanted to do something that gave us evidence of that. And prior to the study, like I said, there was no evidence that anything really worked with this population. So we embarked on one of the largest studies that's been done with this population ever. And we randomized over 1,300 youth, and we randomized them either to YV Life Set services or usual community services. So that could be a range of anything that has been available in the community. And those kids got a packet and a list of all those usual services. And so about 60% received YV Life Set services, and 40% were randomized to usual services. And we have impact data from that research. We started actually randomizing in October of 2010, so that gives you an idea of how long this has been going on, and we just received this year impact outcomes for the 1-year follow-up post-discharge on those youth that were randomized. Mike, do you have anything you'd like to mention before I go to some of the impact? And you can't do a study like this without having a great partner and having the Department of Children's Service here in Tennessee work very closely with us, getting access to data and helping us locate kids. Because we had to do, on all the 1,300, we had to do an assessment, and then there had to be a process of, how do we find the kids and get the assessment and referrals and working together. So I don't know if you had anything else to say about that. And I don't have to, you can read that, I don't have to read it to you, but there's some significant impacts. And if you even just look at the 30% decrease in violent relationships, we have special protocols in place where we train staff on how to manage and deal with domestic violence, and it's very prevalent with the young adults that we are working with, but also from a cost perspective, we know that those involved in violent relationships usually are accessing and have higher health care costs. And so there could be other benefits that just don't show up on here. We're working on, these are things we're currently working on, a 2-year impact. So we've done the 1 year, now we're working on the 2-year impact. Also the cost benefit analysis, as far as looking at YV LifeSet, the cost and what the impacts are having, just like I mentioned on the domestic violence, with other costs that maybe you don't see right away. And then we're also looking at doing other studies with LifeSet. You know, should we do it in another state with a different policy context? And also, is it transportable? Can you see impact when other partners are implementing this program? And Pat, I think you're next.
This is our first venture into such an extensive clinical trial. And there's actually been 4 clinical trials. This is the largest ever done. This is a man is named Mark Courtney. He was a principal investigator, which is kind of the guru. And this is a quote from him after the first data came out. It's the only program to show impact in multiple domains for target population. And Tennessee, you know, is pretty broad state with rural and large cities, African American communities, you know, Caucasian communities. So we had the same success across all those regions, as well as groups of young people as well. Just a little bit about the partnership, and I mentioned briefly about Mr. Day, who we met in 1999 and gave us funding for 3 years. Well, Mr. Day, after 3 years, said, "I thought you said you were going to get some funding from the state." We said, "Well, the state really didn't have any money." And he said, "Well, I'm not going to give you any more money unless you find some money." So we agreed to start matching his money, and this was just a few $100,000 a year. And so we said, we'll raise match money to help these young people. But finally, 2006 came, and Clarence called me and said, "Hey, how's that funding going with the state?" We were serving maybe 100, 125 young people a day. And I go, "Well, not so good." And he goes, "Well, I thought you would get some match funding." I said, "Well, we're working on it, Mr. Day." And about a month or two later, Mr. Day just calls me out of the blue and said, "I'm done with you. I'm done with the program. You said you get match money. I'm finished." Of course, I was devastated at the time. This is a program we put a lot of resources in. Most of the money we were raising was going into this program. Called me back a couple of days later and said, "I've changed my mind. I've changed my mind." And he said, "I've decided that I'm going to continue to fund you, but you have to raise some match money." And I said, "Well, we are raising match money, Mr. Day." He said, "No, you can only get money from one guy." I said, "Well, who would that be?" He said, "Phil Bredesen. You get his money, then you'll get my money again." Well, Phil Bredesen was the governor of Tennessee at the time. And I said, "Well, Mr. Day, it's not like Phil and I are close. I met him once at a political fundraiser years ago, but," he said, "you want my money, you'll get his money." So through several months of working through the state, we had a wonderful meeting with Mr. Bredesen, or Governor Bredesen, and Mr. Bredesen agreed to match Clarence Day's money, which is $1.5 million over 2 years, which meant we were going to have $3 million to sort the program over 2 years. So exciting time, but still, that was only about 20 to 25% of the kids we were caring for across the state. We made a lot of progress. We made improvements in our program because we had additional financial resources. We spread it throughout the state as well. But a couple of years ago, as we were continuing to talk about the development of this program while the clinical trial was going on, and we felt good about our outcomes because we were already collecting outcomes of our own, we said, how can we, we want to serve, and Mr. Day always wanted to serve every young person in the state, he said. And so we went back to the state with a bigger offer and said, we'd like to make a commitment to match the state through funding from Mr. Day as well as ourselves over the next 4 years to meet the needs of every young person aging out of Tennessee. Tennessee has 600 to 800 a year young people aging out, and we committed $12 million. And fortunately, we had a fantastic governor that agreed to that. So over the 4-year period in Tennessee, we have $6 million a year to serve every young people aging out of the foster care system in Tennessee. So that's just a little bit about that story. And I'm sure these guys are going to tell you a little more about how the policy and the financing of that later. This is just a picture of the governor, one of our young people there, when the announcement was made. And just a little bit about nationally. This map represents all the different young people that age out of the foster care system. There's about 23,000 young people that age out a year across the country So give you an idea how many young people age out of foster care. And from our understanding, also the number is going to be going up over the next few years as well, just from the number of kids in custody across the country. This was actually done as part of our business plan, which was about 2.5 years ago we started. But you think about young people. I mean, if you go to the prisons, if you walk and talk to the homeless people, if you go to mental health institutions, you will find a significant number of those young people grew up in the child welfare, juvenile justice systems. Just a little bit also about our Tennessee program. Tennessee has a combined Department of Child Welfare and Juvenile Justice called the Tennessee Department of Children's Services. So we're also serving juvenile justice kids and child welfare young people as well. And that's representing the data you saw earlier. But what as an organization, we've asked ourselves, what can we do to impact all these young people? And because most states, I don't know if you know about a lot about what your state's providing, most states have a handful of staff, maybe 3 to 7 or 8 staff that are working basically with 75 to 100 young people at one time, mostly a phone call, occasionally check-in, occasionally a referral to somebody rather than any intensive level of services. Just to give you an idea of the significant range of challenges I mentioned briefly, you can see young women. This is basically comparing the national representative to young people not in the foster care group and kids who are in the foster care group. And you can see so much higher in pregnancy, arrest before 21, no high school diploma or GED, homeless, and mental health problems. A pretty tough group of young adults. This gives you an idea of the cost. Did you say $8 billion? Was that the number you used, $8 billion? Yeah, when we began our research a few years ago, the number we had was $6.9 billion. You can just see the cost of these young people to society. And these, you can see where the sources are. You're talking Jim Casey, a lot of really national research institutes provide this data. Now, here's why we're really here today. Of course, Youth Villages, we ask ourselves, how can we help impact these young people across the country? And we actually thought a lot about doing it ourselves, but we know with almost 3,000 employees now, our hands are full. And also, every state is so different. Every state has their different rules, regulations, but what's so important we find in states are relationships and history of providing services. And so what we've decided to do as an organization is we've pooled some significant philanthropy, and we are basically decided to try to help other people provide these services in their own communities, to partner with program providers. Rather than being a provider ourselves, work with people in the community that provide service for you, are passionate about these young people already, maybe providing some small level of services just because they're limited resources. And as an organization, that's what we're looking at as well. We have raised significant national philanthropy to help match local geographies that want to provide this service, whether it's a county or an entire state or a particular city. We will be asking those providers to also help provide some local philanthropy as well. We'll also need some champions at the state leadership level as well, or county level. What we found in the states, we've had success with our program, mostly in Tennessee, Massachusetts, North Carolina, and recently Oklahoma. There's been a lot of champions there, not just at the state level, but also the philanthropic community as well. We also need good service providers that have a history of providing high-quality, community-based services. And we also want to continue to do research and evaluate the programs, because I will tell you, I was in South LA a few months ago, and that is not Memphis, Tennessee. And I will tell you, they know the programs. I mean, they know that community much better than we would ever know that community. And we need to have people that really understand those communities and have the relationships at the state level as well, and then philanthropic community also, but also advocacy group and policy influencers. This is just a little bit about what we're asking champions or states to provide. And this is basically philanthropy, state support, good service providers. You know, we were in a state recently and they said, look, I don't think we have any good service providers to provide this service. We need your help. Well, we think the states do have good service providers, and they may not be as many as they would like, but we really believe that they do have some, although we're willing to expand our program somewhat. But we really feel the best avenue for us to really expand our programs is to teach others to use our model. This just gives you some of the areas that we want to have really the support as well. You know, we're also looking for states that want to do more than just provide service in their state. We're looking for kind of a big voice across the country. We know that we can't go into 50 states, but we think over the next 10 years we can partner with 20 to 25 states to provide these services. And what we typically find, you know, that when one state or a group of states do something very well, other states will kind of observe and find out what they're doing, and maybe, hopefully, we'll share that experience with other states. But we have to have states that, like I said, are willing to collect data, but also have leadership at the highest levels in government to support it. Because I will tell you, and y'all probably know this from your own experiences, if you have a champion at the highest level at the Department of Children's Services or Child Welfare Department, and they leave, or if you have a governor or someone in the governor's office or a key legislator that supports your work and they leave, sometimes it's difficult to maintain the sustainability of a program. And we think it's important to have several. And we also want states that really want to have a real impact, not just serve, you know, 15 or 20 kids. I mean, they're really passionate about serving all the kids in their county or their particular state they're responsible for as well, to have a significant impact. We really want to be able to provide services or to every young people across state, or teach other people to provide services, or hopefully even copycat programs will develop. But before I finish, I do want to tell you about one young person's story. And let me find the young man. Then I'm going to turn this over to our friends from Tennessee. This young man here to the far right, his name's Fred Burns. Fred came to us, he was 13 years old, one of 10 kids. Family had terrible drug and alcohol problems. He lived in shelters and foster homes, and they were scared out. He and his brothers and sisters through most of their life. Came to us in our foster care program, later went to one of our residential programs. We finally convinced one of his aunts to adopt him. Fred was the first young man to ever graduate from high school in his family. He graduated valedictorian from one of the largest high schools in Jackson, Mississippi. Walked on and played football at Mississippi State. And this might sound strange, but he came to me after the first year and said, Pat, you know, I'm thinking about quitting football. And Fred was a very talented football player. I said, why? And he said, I can't get my afternoon labs in for chemistry, and I'm having trouble getting my schoolwork done as well as playing football. He said, I love football. Fred graduated about a year ago. Fred's a software developer for American Airlines now in Dallas, Texas. And it's just an amazing story when you see the development of this young man.